watching Let's Chat.
Joining us this morning with something that you definitely need to know about is Dr. Rob Headrick. And of course, you may know Dr. Headrick is the Chief of Thoracics at CHI Memorial. Dr. Rob Headrick, good morning.
Good morning.
You have been instrumental in getting a new mobile bus to go around screening for lung issues, lung cancer, lung disease. And this is something that's been kind of a pet project of yours now for how long?
Probably going on about 4 to 5 years.
And you're finally seeing the reality at the end of the road, so to speak.
We are. We knew, one, our community has a lung cancer problem. It's not we're bad people. It's just our genetics, our environment. One person every 2 hours is dying of lung cancer. So this was an idea of how do we solve that problem? How do we keep people in our viewing audience alive a whole lot longer and a better life? One, we got to make healthcare easy. And two, we got to get the technology to the patients, to the patient coming to us. And that's what this project was all about.
And this is a new state-of-the-art mobile screening laboratory, essentially.
It was the first in the country, soon to be updated to version 2. This bus that we built was actually a prototype to see if we could do it. Would patients embrace it? Would they be okay with us coming into their communities, into their place of worship? And the biggest thing we learned is that, yes, people want easy and affordable health care.
Tell us to what extent folks have embraced this mobile screening.
So the biggest thing is, particularly the pandemic, it's a very safe place to get your imaging. Routine health care, all your screening exams are done when you feel well, and nobody wants to spend much time at a doctor when they feel well.
Sure.
So they've jumped on board. We found just what the study suggested. The majority of the lung cancers you find will be in an early stage when cure is likely and treatment is easy. And looking at some of the notes that you gave us, the government has now decreased the amount of years and the amount of time you may or may not have smoked, so you can adequately and accurately get screened. Tell us about that. We've stayed up, kind of tried to stay ahead of the data, certainly focusing on who should be screened and trying not to over-screen. What we realize, particularly in our community, smoking has less of an issue than we thought. So the government's lowered the smoking criteria, so it's only 20 pack years. That's 1 pack a day for 20 years would be equivalent to that. We've also lowered the age to age 50. 50 seems to be when your genetics really start playing out. And the idea is really to start increasing the number of people who would be eligible for lung screening, trying to save more lives.
Who is the perfect candidate for such a screening?
Always look at your family history. Go back in, if your mom, dad, brother, sister have had any type of cancer, it automatically elevates your risk. And then certainly as you get over the age of 50, some of those genetics start playing out. And these are all things you can't feel inside of you, so you have to have some type of an imaging scan. And then lastly, if you have smoked, if you've worked in a coal mine, in a brake plant, around a lot of dust, poor environments, ought to have your lungs looked at.
All right, let's say someone goes and gets the mobile screening, whether it comes to them or they go to it. How long before they find out the results?
They're going to find out the same day.
Same day.
Who likes going to the doctor and saying, I see a picture of you, but I can't tell you for a week what's going on?
Sure.
That just creates anxiety. All this is meant to be easy. Go to the patient, 10-minute exam, get off the bus, go do your rest of your day, and hopefully we'll give you good news in a short period of time the same day that you have the exam done.
What happens if the news is not good?
Well, likely, the good thing is if we find something bad, it was going to happen anyway. We're just going to find it when treatment's simple and cure is likely.
And that's certainly many blessings all wrapped into one. If folks would like to invite you or invite the mobile screening lab to their church, to their office, what do they do?
Yeah, very easy. Just call us at 495-LUNG, L-U-N-G, or go to mylungcare.org and you can find out a lot about us, or my Facebook page, Dr. Rob Headrick.
And it's easy to find. Great guy, Dr. Rob Headrick, thank you so much. And again, the folks at CHI Memorial just leading the pack in detecting lung cancer and other respiratory diseases. Dr. Headrick, thank you so much. Stick around, we'll be right back.